welcome back to UNFPA's What's Next event, a series where we're exploring different dimensions of population dynamics. Today, we're going to be talking about COVID-19, baby bust. How has the pandemic affected birth rates and our demographic futures? This is organized by UNFPA, the United Nations Population Fund, and my name is Ian McFarlane. I'm going to be moderating the session today. We are celebrating on Sunday, but we're doing it now, World Population Day, which is a day where the UN brings attention to population issues and offers a space for constructive conversations around what the issues are in our times. And in our times, of course, a lot of attention is being paid to COVID and its impact on fertility rates. And that in our region is also against the backdrop of concerns, heightened anxiety about the changes in populations as we see people having fewer children, as we see people moving to other countries, out migration. And we want to shed some light on what all of that means for people. We want to use the data, so we want to be able to use evidence to examine how the pandemic is influencing the demographic trends. We want to bring in the perspective of people, because this is really about rights and choices of people. And we want to also try to find some answers to the bigger questions that people are concerned about. What is the long-term effect? Is this doom and gloom? Or is this trend perhaps even something positive? We're going to be listening to the views of a very diverse panel of 5. I'll be asking 2 rounds of questions firstly to Thomas Sobotka, who is working at the Vienna Institute for Demography. I'm going to be asking questions to Stuart Geetle-Baston from Hong Kong University of Science and Technology. We also have with us Aliona Kretsu, who is from the Ministry of Health, Labour and Social Protection in Moldova, and Stephanie Haggerty, who is the BBC's population correspondent. Also very pleased in our panel, we have Basha Baran, who's a sexologist, psychologist, and part of the Sex Ed Poland Foundation. With those experts, the voices, we hope to bring out some of the issues that are affecting our times. I would also like to point out that we are live on Facebook. To our audience, you are welcome to contribute your own thoughts through the chat or on Twitter. Please use the hashtag demographic resilience, and we hope to be able to respond, bring out your questions and your suggestions as we go through the panel. So with that, firstly, allow me to direct my first questions to Thomas. Thomas leads the research group on comparative European demography at the Vienna Institute for Demography and is one of the leading experts in terms of fertility and families. Thomas, what does the data actually tell us right now about the impact of COVID? Has there been a baby bust?
Thank you very much, and I'm delighted to join the discussion today, and thank you also for all of you waiting for us to start. So to start very briefly and to give a quick answer, the answer is overall yes, but there is a but. So let me explain a little bit more. The first thing is, differently from deaths, we don't see the immediate impact of the pandemic. Obviously, it takes a while to get pregnant, and pregnancies typically last 8 to 9 months. So if you think that the pandemic started in earnest, affecting many countries in March 2020, when people initiate pregnancies in March 2020, we see the first impact on births happening in November, December 2020. Then it takes us a while to collect the data to get them from national statistical agencies. So what we can observe now is just the initial impact of the first 5-6 months of the coronavirus pandemic, with many things still unfolding. So that's the early evidence which we have. And most of the data we have so far are for the highly developed countries. So I will be mostly speaking about countries in Europe, East Asia, United States, Australia. As far as I know, the evidence is very similar for Latin America, but the data I have don't really allow me to say much for other regions, and that could kind of lead to a separate discussion. Then the main story which we see is actually generally in line with what demographers know about the effects of uncertainty on birth trends. Many people tend to delay childbearing. Many people tend to delay important decisions such as starting a family in uncertain times. And this is what we see on balance at the start of the first wave. When we look at the birth trends since November last year until January, February this year. Now, I have to say also that what we see in these aggregate data is the overall balance of different decisions and different behaviors of different couples. People respond differently to difficult situations. For some couples, this may even be an incentive to decide, okay, now we are at home, let's have a baby. For many people, this is a period of uncertainty. And we are also in for some surprises. And maybe I would like to ask Cem to share a picture with us where I can illustrate some of these trends and surprises. So here you have a kind of summary picture of birth trends in the European Union countries, 9 countries with good data until April this year. And what we see here that before the pandemic affected birth trends, so for all the births until September last year, September 2020, there was a slight decline in the number of births compared to 1 year before, to the period until September 2019. That's perhaps the easiest way to compare the trends over time. So European birth rates have been slightly declining, but then as we move on through October, November, December 2020, and then January 2021, the births are sliding down on average. And in January 2021, the average decline in the number of births across these 9 countries is by 12%. That's quite a big decline in such a short time scale. But then comes a surprise. We see an upturn. We see a small baby boom in March and April 2021. Why is it so? So when we go back to January, these are births typically conceived in April and early May last year. That was the peak of the first wave, when there was a lot of uncertainty. What will happen with the infection? How the lockdowns will affect people? What the future will bring? So really clearly in most countries, this uncertainty brought a decline in birth rates. And obviously many people started postponing childbearing. But when we look at the latest 2 months, these are associated with the period around June to early August last year, when things were looking up in most highly developed countries. And obviously, many people were optimistic. Many people thought, we are behind the pandemic. The pandemic is over. We can go back to our normal lives. We can start living again. We can start having children, planning our families. So we see a small baby bust, which is probably associated with these positive feelings about the pandemic easing out or even ending. What we don't know about how this will unfold later on. And my very speculative argument is, as we will go into the second and third and maybe fourth and fifth waves, we will see birth declines again. And these birth declines in many countries may be bigger even than in the first wave, because the repeated lockdowns and other worries were taking higher psychological pressure and bigger toll on many couples who had to deal with homeschooling and a lot of stress with the family and with all the uncertainties. Now, to finish my short commentary, and maybe now Cem can close the picture so that we can see more properly the faces of everyone. We don't need a picture anymore. Thank you. I would just like to say that countries differ, of course. So we see some regions where births were sliding really a lot on a big scale. Southern Europe, especially. Italy, Portugal, Spain, we see an immediate big decline in birth trends around December. in Spain by 20%. And that kind of makes sense. These are countries where the pandemic was hitting really hard in the first wave. And these are the countries which don't have very strong family policies overall. So families are struggling more with all the difficult, uncertain situations. We have countries where somewhat counterintuitively births were increasing during the pandemic. Not many of them, but in Finland, more couples were having kids during the pandemic. In the Netherlands, there was some slight increase in the number of births during the pandemic. And we have countries where nothing happened overall. Czech couples, I don't know whether they are too calm, they don't care. There was no change in birth trends in Czechia. So we have to take also into account these differences between countries in the way how pandemic was playing out in people's lives. And that means differentiated fertility responses during the pandemic. Thank you.
Thank you very much, Thomas. Thank you very much, Thomas, for those for drawing out the data. Very interesting to see, firstly, that of course there's a variety, or it happens in different ways in different countries. So we can't make general assumptions around whether we are seeing a baby bust or not. Secondly, very interesting that you raised that issue of the factor is uncertainty. That is what triggers whether or not families choose to have children or to delay having children. I like very much also the point that you made where you did reflect on where countries don't have family policies or don't have policies. So there's a link, I think, between using the data to develop the best possible policies that respond to the circumstances in any country. But thank you very much for that response. Let me now turn to our next panelist, and I'm very, very pleased to welcome Stuart. Stuart Gatel-Baston is Professor of Social Science and Public Policy at the Hong Kong University of Science and Technology, and he's the Director of the University's Centre for Aging Science. So Stuart, we heard about some of those recent numbers, and perhaps how that fits into a wider trend. We know that countries, particularly in Eastern Europe, but countries everywhere, are seeing declines in fertility, and without migration, that affects the population structure, the population numbers, and it's creating anxiety. Do you, from your perspective, do you share the concern about low birth rates and population decline? Is this really something that is something we should be very concerned about? What's your perspective, Stuart?
Well, thanks very much, Ian. And I do share the concern, but I think perhaps not for the same reason that many people in the region do. I think that there's this panic about population stagnation, population decline. And we really have to kind of unpack, like, where does that come from? With, you know, we to use our bit of jargon, we might say there's a little bit of ethno-nationalism, right? That we equate population size, population growth with strength somehow. Now, of course, this doesn't really make a lot of sense when you boil it down. Firstly, we can be talking about countries which are very new, for example, so that have maybe not been in existence in their current form for very long. We also know plenty of examples around the world of very small countries in terms of population size who are very powerful, you know, Switzerland or Luxembourg or Vatican City, even they are very small population sizes, whereas other countries with hundreds of millions of people living there are you know, perhaps less economically successful or geopolitically successful than some of these other smaller countries. And then also, of course, we have to think about the process, the kind of inevitability of this, right? It's not that all countries have seen, you know, kind of flatline population or steady population growth for hundreds of years, and then all of a sudden it's all collapsing and tailing away. Of course, that's not the case. This era of tremendous population growth that we've seen in the 20th century is an outlier in human history, and it will probably almost certainly, I would say, never happen again. So we're seeing a natural. What we're actually seeing is a kind of a natural change. Now, of course, there are some places who are undergoing that change at a more extreme pace and a quicker pace than others, and that's without a doubt. And so I am worried about some of those issues. But again, it's not about the number of people. I think, to be quite clear, the number of people, even the shape of the population, the structure of the age structure, is kind of irrelevant unless it's mapped onto or it relates to some institutional system. So, like, we worry a lot about the number of people aged over 65, for example, but nothing biologically happens at 65, right? It only makes a difference if you're kicked out of work at 65, or if you receive a pension at 65. Now, having said that, these trends are certainly in place in Central and Eastern Europe and in Central Asia. And there will be an impact. If you have a pay-as-you-go pension system, you've got fewer and fewer people paying in, and possibly more and more people taking out later on, then of course that's going to become problematic, right? If you have, in terms of social welfare systems, in terms of healthcare systems, a smaller population, and not just a smaller overall population, a smaller working age population, and a much larger older population, which is really, I think, a bigger issue, is going to put stress on that. At a kind of less perhaps glamorous level, if you have a population which is spread around the countryside, right? If you have rural depopulation, that's going to be much harder to deliver social services and public services. If you have de-urbanization, so towns which are getting smaller, then you have to think about planning and the way people move around. Cultural heritage, intangible cultural heritage, languages that could, dying away. These are important things, right? These matter in terms of depopulation. But I think that the problem with the narrative at the moment that we see, and I think this is kind of appropriate for when, as we head into World Population Day, is that we see these as demographic problems. And the temptation is to look for a demographic solution, right? Let's have more babies, right? And babies are a very, very inefficient way of fixing these issues, right? Babies don't work. Babies are not going to fix the pension system anytime soon, right? So I think that we have to think about this on an institutional level, and that's politically very difficult. Just, I know we have a lot of friends in Russia watching this today. Well, the Russian government doesn't need me to tell them that changing the pension age, changing the retirement age, is pretty unpopular. But that's going to be a challenge, right? And that's something that will need to be done. I think, and then I'll perhaps return and talk about this later on, so we can move on, because I know the rest of our panelists have got much more to say than I do. But my other real concern, the other reason why I'm worried about it is the fact of these very low birth rates. Why are we seeing these very low birth rates? Why are we seeing such high levels of out-migration? But I think I'll let the other panelists come in now, and I'll perhaps return to this later on.
Thank you very much, Stuart. And yes, indeed, the conversation will grow and flow as we go around. But I think it's very important that you've highlighted for us the bigger picture. I mean, we are looking at a few years of COVID, but we're looking at a century where you said there'd been exponential growth. So I think sometimes our assumptions are we're not mindful enough of the bigger picture and how all of this connects. I liked also, if I may say, how much the narrative of explaining that, of talking about what is really happening, and taking this outside of just both a numbers and a demographic issue into a society issue. And it's not necessarily only about how many, but how you manage the number of people that you have, whether that's in terms of the changes needed in pension age, etc., etc. But thank you very much for kicking us off and inserting us into that bigger picture. I'm going to now introduce Aliona Crețu, who is in the Ministry of Health, Labour and Social Policies in Moldova, for sort of a practical country experience. Aliona is head of the Demographic Policies Department. It's self-interesting that you have a Demographic Policies Department within your ministry. And obviously, you're a smaller country compared to the population numbers of other countries. But as I understand it, you've made a shift in your approach as a country, a shift away from numbers. And perhaps you could say a little bit, Ms. Crețu, about why Moldova has made that shift. What are some of the issues in terms of your approach and your national experience? Thank you very much, and over to you.
Thank you very much, Ian, for the invitation and for the opportunity to talk about changing the demographic vision in the Republic of Moldova. To begin with, I would like to give you a snapshot of current demographic situation in Moldova. It's a country with light immigration rate and a rapidly aging population. The fertility rate is 1.8 children per woman, and the replacement level of the population. To better tackle this issue, we decided to change the demographic perspective by moving from beyond the narrow short-term approaches that would bring political capital and which were focused on population number towards comprehensive policies for society and population, which puts people and their rights and choices first. Why? Because in the absence of cardinal economic transformations, the solution to stimulate the birth of more children will have no other results than the migration of these children with their parents, or they will emigrate when they are economically active. At the same time, by stimulating natality, there is the risk to attract vulnerable families with financial incentives, which might lead to increasing poverty, youth unemployment, and unbearable cost of social protection programs. So how did Moldova get this approach in the first place? 10 years ago, the government of Republic of Moldova developed the national program on demographic security, which focused in particular on increasing the population or the working population, and less on the quality of human capital. 5 years later, the program was revised, and the mid-term evaluation concluded that even if fully implemented, the government will not achieve the initially set targets. As a result, in 2016, Moldovan government decided, with UNFPA support, to develop a new concept, vision of population and development, based on human rights approach, which was approved by the National Commission on Population and Development. This concept was focused on the qualitative aspects of the human capital and human rights, on personality development with individual abilities, preferences, aspirations, more productive and healthier lives, maintaining dignity and rights. New demographic vision also set the all of government approach, getting all ministries involved in population issues rather than appointing the Ministry of Labor and Social Protection as the sole responsible entity. We are happy to acknowledge that this new concept vision on population development already is working, and at the policy level laid the foundation for many strategic documents, such as the National Development Strategy Moldova 2030, which focuses on the quality of life. The document highlights the demographic changes that are taking place in the Republic of Moldova and how they can influence the country's development for the nationalization of the Sustainable Development Goals. With the new data in place from the Generations and Gender Survey and population projections from the Demographic Research Center, the government developed a theory of change of demographic resilience. The document analyzes the demographic context in the Republic of Moldova and sets policy priorities for managing demographic changes. It is based on 3 pillars: adaptation, attenuation, and adjustment. Policy priorities for demographic resilience are right now integrated into the National Development Plan for 2022 to 2024 and in the relevant sectorial strategies. The shift from demographic security to resilience would have been difficult without UNFPA. We not only benefit from expertise and funding, but also from a variety of approaches, ranging from UNFPA meetings with government and parliamentarians to policy guidance, expert exchanges, and international meetings. UNFPA was instrumental in helping convince decision makers, and all this is crucial to achieving the SDGs. Thank you.
Thank you very much indeed, Ms. Kretzer. Thank you, if I may say, for the compliments to UNFPA. We acknowledge the partnership. We're one of the contributors to the changes that are happening in your country, and we work together with, of course, your institutions. But I think this is an issue that is not just, as you indicated, actually, it's not just one sector. What I picked up from what you were saying was how you had a sort of cross-ministerial approach, how it was not just in the Ministry of Labour. And this, as Stuart was saying, this is not just an issue for one particular ministry or one particular entity. This is looking across at the implications of changes in population and adapting the policies across the board that need to be put in place. And as you highlighted, keeping at the center of that policy conversation, the question of people and rights and the quality of human investment. I was very interested by your theory of change. We might come back to asking you about how this has all changed results. What has it meant for people? But now allow me to go to our next panelist, our fourth panelist, who is Stephanie Hegarty. Stephanie has been the British Broadcasting Corporation's population correspondent for over 3 years, looking at demographic change across the world and how it is altering the way in which we live. Stephanie, thank you for joining us. We look forward to your views. And I'm just curious, though, if I may start with the significance of the BBC having a population correspondent. I think that's quite an interesting development. It's back to reflection of how in the media we are seeing the need to report more on and investigate more about these questions of population. But I'd also like to ask you a little bit about some of the research and the conversations that you've been having. I saw one of your recent articles, how can we convince people to have babies? That was the headline. So what are you seeing, what are you hearing about the connection between fertility and choices in the COVID pandemic, but more broadly too, around the world, this question of population and what it means for sexual reproductive health and rights for those people?
Yeah, I should say that was the headline, but we did get on to should we convince people to have babies later in the piece. But yeah, I think so. Why? Now, I didn't create this role, obviously, but as far as I understand, I work for part of the BBC where I report in English, but also for our 40 other language services, some of which are in Eastern Europe. But they're all over the world, and a lot of these regions are experiencing huge population change, whether that's as a result of fertility, like higher fertility or lower fertility, or because of migration from urban to rural, or now backwards, as we're seeing in some places. rural to urban, now urban to rural, and then also global migration as well. So it was those population issues, and then more broadly, these macro issues like climate change and how they're going to affect population movement, growth, decline. So it's a lot of different issues. And I think for the World Service, what they wanted was someone who could put these things in perspective from a globally. So say whether it's the person selling mobile phones in Lagos or an investment banker in Delhi, try and tell stories that can kind of put the position of these people in a more global perspective. So that's the job, not strictly about fertility, but it's definitely part of it. And in terms of the piece that I wrote, how to convince people to have babies, I think the top line was it's very hard. And lots of places have tried with very, very muted success. I used a few examples, and one of them in a kind of not very positive light was a country like South Korea, which has tried a lot of different things and thrown quite a lot of money at the problem, and done positive things in terms of policies like you seem to be doing in Moldova that will affect well-being and quality of life, like trying to increase access to childcare and baby bonuses. But what they haven't succeeded in doing is tackling the social forces that are stopping people, leading people to make the decision to have less children or no children at all. And I think one of the big ones is in South Korea anyway, in Japan, maybe a little less so in China, is this patriarchal social system where women still have the huge bulk of the labor in the house, domestic labor. And I think that that's a problem all over the world. I don't think any nation has achieved parity when it comes to domestic labor between moms and dads, but it's quite extreme in South Korea. So I spoke to quite a few women who were just saying, I don't want that life where I work all day and I come home and I work all night, I work all morning. And it's just a very simple lifestyle choice. And I think we see that less, we see that in Western Europe, but one of the places or regions that seems to have made a lot of progress on that is Scandinavia. And that is partly driven by government policy in convincing fathers to take longer paternity leave so that the labor in the house is kind of divided from a much earlier stage, that for a certain amount of time, fathers are the primary carer. And that seems to have really disrupted the imbalance in, the work that moms and dads do at home. And it's had a positive, along with a lot of other family-friendly social policies, had a positive effect for a long time in seeming to stop fertility decline and encourage more people to have babies. But I think we'll come to this later, but it seems to have leveled off in the past decade or so, which I think demographers in the room can tell us seems to be confusing some people. And this model, the Scandinavian model, what I learned from the piece, which was being touted around the world as great and is great for lots of reasons in terms of well-being, is not having the desired effect anymore on fertility. And that was really interesting. Yeah. I think the message was it is very hard, but these policies in countries that, and I was really interested, I wish I'd spoken to you for my piece, Aliona, because Moldova sounds like such a great example. But these policies that increase well-being have so many other beneficial factors that even though they may increase fertility, like making things fairer at home for moms and dads, increasing the amount of paternity leave available, trying to create a work culture where it's okay to leave when you have young children. I think that really struck me as something in Scandinavian countries that was markedly different from life here in the UK anyway. These are all beneficial policies that could lead to higher fertility, but will inevitably lead to higher well-being.
Thank you very much, Stephanie, for those comments and telling those stories. I think so. This question of course, there are different models, and some of them are working better than others, and it shifts over time. But I think I understood what is clear is that overall gender equality and the kinds of family-friendly policies, the policies that enable people to make choices, that is going to be more likely to not necessarily change the numbers of children people have, but at least make them able to have however many it is that they want and when they want them. And that sense of not of burden, but of contributing to society in a positive way, and having the conditions, the policy framework around that encourages that and helps that, surely is part of a positive narrative about potential rather than the other narrative around panic. And I think what you're sort of conveying is that finding that the right balance and the right roles between men and women and enabling them to fulfill their potential is something that's very, very powerful. And we'll hear a little bit more about that. But it also links back to the points that Stuart was making around the range of policies. And thank you also for situating it in the mega trends, which are also, of course, very much part of our narrative as we live through climate action, climate change, and many people moving because of that, and or because of conflicts and fragility in the societies where they live. But thank you very much for raising those points, and we'll come back to some more questions in the next round. So it's now with great pleasure that I invite our friend Basha Baran, who is a psychologist, a sexologist, and a board member of the Sex Ed Poland Foundation, which is, I understand, the biggest multimedia platform in Poland, providing comprehensive sexuality education and direct support to young people. So shifting to that focus on young people, the next generation, Basha, perhaps you could say a little bit from your conversations directly with young people, how are they seeing the relationship between the pandemic and their own sexual and reproductive health desires, their plans for perhaps having children? How are young people that you know, how are they reflecting on this, and what are the lessons or the implications for all of us? Basha, over to you.
Thank you, Ivan. I'm happy to be here and to represent Sex Ed PL Foundation. Let me shortly introduce us. So our main goal is to provide comprehensive, age-appropriate, reliable sex education. Most of our work is done through different digital channels, where we publish actually every day, and we reach a monthly number of views around 13 million. Collective number of viewers that we collect around the different platforms is around 500,000. A big part of our work is providing direct help. So just shortly before the pandemic, we opened that option that our viewers can directly talk to our educators. And till today, we manage through that option support our viewers in 9,000 cases. So it means that we have quite wide knowledge of people's thoughts, feelings, needs regarding sexual life. And although we focus mostly on youth, we notice that people that contact us are from the age group that starts at 11 till 75. So responding to your question about the changes that we notice. So first I would mention mental health issues. So we hear many stories, much more now, about the extreme stress, depression, anxiety, and simply about loneliness. Because at the stage of that development, I mean the adolescence and young adulthood, it is pretty crucial for young people to have close contacts with their peers, and pandemic made them keep the physical distance and limit the number of people that they can stay in touch with. So what we see is that young people, they try to adjust to that new situation, and they fulfill those needs of close contacts in the internet. So of course it was happening before the pandemic as well, but now the internet is really the main place where they look for partners, where they date, flirt, and even where they have first sexual experiences. But I want to point that those behaviors, I would say that the central motivation is not purely sexual. I mean, they're not doing that to have sexual gratification. They do that mostly because they look for emotional closeness. And I think now it is for them way more important when they live under such stressful conditions. So in general, that makes it totally different reality from, for example, what we experienced growing up. And in our experience, it is very difficult for parents and for teachers to understand it, to understand how much of social life of young people happens online. They are often unaware of things such as online sexual violence, so they are not reliable source of support. And when you look at Poland, I think that's something typical for Poland, that young people won't find that type of support at school, because there are no comprehensive sex ed courses in Polish schools. And regarding that issue of having children, very often in our conversations, we hear that young people, that's something that they wish for, they want it, but they postpone it. And the most common reason for that is uncertainty. So that relates to what Thomas described before. And they really say that their life conditions are way too unpredictable to make such decisions. So to sum up, when we look about the sexual behaviors, the changes that we see, in general, more sexual behaviors happening online, more importance given to emotional closeness, worse access to sex education and healthcare, and some kind of longing for basic safety.
Thank you, Basia. So, I mean, it's just, I think you've also helped us ground a little bit what we're talking about today back into the lived experience of people. And of course, we've been talking about evidence and data, we've been talking about policies, we've been talking about practicalities too. But when you've helped us, I think, reflect on, you know, what is it that young people are actually going through? And it is it's a difficult, if I remember my own experience, growing up, adolescence is not a straightforward process for anybody, right?
Well, yeah.
When you throw into that this dynamic of, on the one hand, COVID and restrictions and legitimate fear and concern, with a digital world which could perhaps be helpful, but also can be still exclusive. Not everybody has access, not everybody understands the digital world. And that basic need that is in young people, but it's in everybody up to age 75. As you were saying, there are people in your program who are older people. That need for human contact and for solidarity, emotional connection. These are very, very profound issues, and I think it's really great that you were able to share those with us, because I think we're going to have to reflect anew in our societies as to how we bring that into the mainstream of the way that societies function, looking at the benefits of the digital world, but also making sure that across the spectrum, everybody is still able to participate. And just to come back to, maybe it's because I'm getting older, but just to come back to that point about the issue of reproductive, sexual health, rights, emotion. This is something that cuts across the whole spectrum of human experience, of course. And I think one thing that we've seen in some countries, and maybe it's the case in Poland, I don't know, where actually there's a lot more intergenerational connection, where grandparents and younger people are connecting, so that younger people are passing on some of their knowledge to older people about how older people can also be part of society through the internet, because they may be not familiar or frightened of that whole world. And then likewise, that the older generation can share their experience, their comfort, their emotion with younger people. So kind of, again, a whole society, but connecting people, and your fundamental message about keeping people at the heart of what we do and what we think about. So thank you everybody for that first round. Keep the questions coming in on the chat, and please keep tweeting. Please use the hashtag demographic resilience. Share your views with us here at UNFPA and the other participants, celebrating World Population Day 2021 with our What's Next series, looking at COVID and its impact on fertility and sexual reproductive health and rights. I'm going to move into round 2 now. So slightly different order, going through the panel. And we touched a little bit. I'm going to stay with you, Vasha, if I may, because you brought out this issue of the trends in terms of digitalization, climate, and also something that we haven't really mentioned very much, but the sort of the narrative and the politics, perhaps, of population. In the beginning of the conversation, colleagues, panelists were reflecting on creating a sort of more positive narrative, a narrative of potential rather than panic. But we also recognize that there are different views, there are different approaches to the question of population, to the rights of women. I just wonder if you would like to say anything about, firstly, those bigger trends, that's happening in the world, climate, digitalization, if there's anything more you'd like to add on that, but also, gender equality, women's rights. Are those changing? Are young people being affected by that, some of those narratives? Does that have an impact on whether they, or how they choose, how they inform themselves about when, if, and how many children to have in the future? Over to you.
My answer will be rather gloomy, because I will focus mostly on conditions that our viewers live in, so the situation in Poland. So Poland, but I think it's really good to mention it here, because Poland is a really good example of what can happen when the policymakers focus on birth control, on birth rate, at all costs. So I mentioned it before that young people who contact us, they long for basic safety. But through last years, we noticed that decline in protecting reproductive rights in Poland, especially those regarding women. And although it doesn't really work, I mean, the birth rate in Poland is declining, we don't really see any signs of changing that strategy. And to give you a wider perspective on reproductive rights in Poland, there is no comprehensive sexuality education in Polish schools, but recently it was announced that agenda-driven curriculum will be introduced. Moreover, there is also a draft law of criminalizing sex education, and that could put educators like me in prison up to 5 years. Another issue is contraception. So according to EPF, out of whole Europe, Poland has the worst access to contraception. It's mostly because all methods besides condoms requires prescription, even morning after pill. And some doctors overuse conscious clause and they refuse to prescribe contraception on religious or personal beliefs grounds. But the most significant thing that happened during COVID regarding reproductive rights was making the abortion law in Poland even more restrictive than it used to be. So now it is almost impossible to receive abortion in Polish hospital. Well, abortions still happen, but the new ban created just a new financial barrier. So if you have money, you can order pills or go abroad. But if you don't have money, then you don't have a choice. In Sex@PL, we really see that from that day when the law has been changed, the top concern that we hear in our conversations is fear around the pregnancy. So people who don't want to be pregnant are scared. But aside from them, and this might not be an obvious effect, people who want to become parents are terrified as well. So what they say is, for example, that they lost trust in medical care that they may receive if they get pregnant. They are afraid that they will be denied prenatal testing or that they won't be informed about full diagnosis. And we know that such things happen. This is not only our observation that people who are planning to be parents are afraid. It is also the statement of majority of professors from Committee of Demographic Studies from the Polish Academy of Science. So that is their prediction, that the ban of abortion in Poland in long term will worsen demographic situation in our country. And I have to comment on that because as a person that supports sexual well-being of young people every day, I'm fully convinced that neither lack of money nor lack of knowledge how pregnancy starts should be the reason why people have children. Poverty, no education are not healthy reasons to become a parent. And in Sex@PL, our top values are human rights, and we think that sex education is just a human right, and that everyone should receive support in making their own decisions regarding safe, responsible, fulfilling intimate relationships.
Thank you very much, Basia, for those reflections and for describing the situation in your country. We also know that in other countries there are conversations around these issues too that are not necessarily evidence-based or rights-based. And I think the conclusions from this panel are that what makes most sense is to take policy decisions from an evidence base, from a data, from a rights-based approach, and that is something that that UNFPA advocates for generally. And I hope that the key messages coming from this conversation will be to encourage all of us to think about how we make sure that that data is available, how we use data, how we bring evidence, and how we keep people at the center of our policy making and our actions. Thank you very much, Basia. Let me follow now around with Stephanie. Back to you. I just wonder if this is a narrative or a conversation that Basia has highlighted, but that you're hearing elsewhere. You talked in your first response. You said, you know, the title of your your article had been, how can we make people have more babies? And in fact, the content was, should we make people have more babies? But there are a number of sort of tensions, of course, between different views, with a focus on numbers versus a focus on rights. Have you any experience of that? And what would you like to share about that? And I guess connected to that, does it really matter about birth rates per se being low? Are we obsessing about something that we shouldn't be spending so much time, but there are other things that we should think about? What are your views, Stephanie?
Yeah, before I get to that, something Basha said just reminded me of the conversation that we had in Ireland when we had the abortion referendum a few years ago, and that the fears that these young people who want to have children aren't just, they're very real. We heard horrific stories about the treatment that women got because of the abortion ban, which was overturned. But yeah, onto does it matter? I think that this is an area that I think hasn't been, I touched on it in that piece, and I want to write on it further because I think that the debate it's not in the mainstream yet. I'm sure you're all having it in your field, but this idea that there is a conception that an inverted pyramid where we have lots of old people and very few working people is inevitably and necessarily bad. And I think that's just not necessarily the case. That an older population doesn't necessarily mean stagnation. There's lots of policies that governments can do. I think someone touched on it earlier when they said, was it you, Stuart, when you were saying that babies don't work? I love that line. Babies are notoriously lazy. So they don't solve issues in the working population. But there's other things, you also spoke about retirement age. I think it is inevitable as we're living so much longer that we're going to have to raise retirement ages. Do we want to be retired for 40 years? Maybe some people do, but I think that there's huge flexibility there that policymakers could think about, allow people who want to work longer, maybe look at part-time working for older people, and other things, getting more women into the workforce. And a lot of these pro-natalist policies do the opposite. They actually try and get, that they're forcing women out of the workforce without putting the other things in place, like childcare. Then you can, change the tax structure, so you maybe tax some people more, and you don't necessarily have a tax deficit when you've got a smaller population. We're going to have huge AI is going to transform work, and it's going to transform our workforces. So that needs to be in the equation. Are we going to need as many people working? And then, of course, if we improve the health of people will be healthier when they're older and will maybe want to work longer. Also, if we improve people's health as teenagers and, through middle age, they will be less of a burden. So an older population does not necessarily have to be this massive burden on the healthcare system, which it is now because a lot of us aren't very healthy. We've got huge problems with obesity and things like that. So I think that this older population doesn't necessarily have to be a negative, and there is in the discourse at the moment, in the mainstream anyway, this idea that older people are bad for your economy. I think that's something we need to overhaul or examine, or at least discuss in much greater depth. And the idea of forming policies that encourage families to have the number of children that they want, but also keep people in the workforce if they want to be there, are really important. That's this kind of nexus that you have to consider both sides, and they can cancel each other out if you're not careful. Also, when we talk about the effect of fertility decline, it's often about the economic effects, and it's part of this idea that economics is all about growth, and that every government wants to create growth, and that is their primary aim and their primary responsibility as a government. And I think that that's starting to change now. We're starting to see metrics like well-being being taken into account, and certain, I think the city of Amsterdam has got this reset policy after Corona to look at happiness as a metric over growth. And I think we'll start to see more and more of that, especially if we start to take seriously this idea that this pandemic can be an opportunity to reset how governments think and how we think about lots of different issues.
Thank you, Stephanie. I think very, very important comments there about how really it's about how we define our lives. I mean, defining age, but also what is the purpose, right? Is the purpose economic growth, or is it well-being and happiness? What might be the implications of a world where, for the workforce, where artificial intelligence plays a much greater role? These are big questions that, of course, they go way beyond UNFPA's mandate. But I think it reminds us that now is a good time to think about how these questions of rights and choices are affected very broadly by the world in which we're living, and they're not just restricted to what we've known in the past, but there are opportunities for new ways of thinking around the potential that we have through digitalization, through redefining what is the purpose, through why should age be 62, 65? Why not be, we limit ourselves so often. I think we impose limits where in fact there is so much in human potential to make the world a better place for everybody. Thank you, Stephanie, for those.
Ian, could I add something? Sorry,
yeah, please, quickly. Yeah.
I get this all the time when I write about this issue. I get hundreds of people getting in touch saying, you haven't talked about climate change. Why are you talking about, why should we be increasing fertility when the world is overpopulated? And I think that is also something that has to be part of this conversation. It is part of the conversation, naturally, that the world, there are a lot of people in this world, and maybe there needs to be more balance of resources, and immigration is obviously one of the answers to population decline, which has positive effects when it comes to how different parts of the world are going to be affected by climate change.
Of course, and thank you for raising that. Maybe that's a next what's next conversation around those dimensions. But let me just keep going with the current focus a little bit on how the values, in fact, or the outcomes of this work, the results of addressing population in this evidence-based, rights-focused way. So let me come back to Aliona on the Moldova experience in terms of, you've had a journey where you've made this shift away from numbers towards quality of life. I know from my own experience in Moldova that there is a high population of elderly people. But are you seeing any results, any sort of concrete changes in people's well-being, their aspirations, or in any of these areas, any results as a consequence of your rethink around the focus on away from numbers? Aliona, would you have anything to add on that?
Thank you for the question. A number of policy measures were implemented to strengthening the principle of gender equality and work-life balance, supporting young people, couples, and families in particular through the introduction of 14-day paternity leave, the extension of nursery services through direct funding from the state budget, reforming childcare leave to be shorter, better paid, with much more significant involvement of fathers. Allowances for families with children are increased annually. The government implemented the New Life program, offering newborn boxes with a wide range of products. As of 2017, the Moldovan government is allocated allocating domestic funding for empowering older people and promoting active aging. A first house program to help people, especially young people, to buy homes at preferential rates was established. The government is also engaged in several reintegration programs for Moldovan migrants. The first wave of the generations and gender survey was also conducted in order to monitor the impact of the new demographic approach and to help Moldovan government in promoting right-based and data-driven demographic policies. In 2020, the Ministry of Health, Labor and Social Protection, in cooperation with UNFPA and the Austrian Development Agency, launched a program that looks on how to expand choices for women and men in the private sector. We are working now on several policy documents to facilitate women's return on the labor market, childcare services, and improving work-life balance. To improve quality of population and migration data, National Bureau of Statistics, with support of UNFPA and Swiss Agency for Development and Cooperation, are helping Moldovan government and in estimation of international migration per each district of the country and revision of the population number per each locality of the country. Which haven't been done in the last 3 decades. Moldova government is also committed to allocate domestic funding to implementing policies that result from the theory of change on demographic resilience that puts human capital and quality of life at the heart of our intervention. With reference to the second part of your question, we hope that the social protection and health care system will become much more equitable, life expectancy will increase, the gender gap in life expectancy will be reduced, employment opportunities will be created, and the Moldovans that are abroad will return. The formal childcare services will be expanded and will offer more choices for parents, and in particular for women with regard to the reconciliation of work and family life, and as a result, this desired fertility will be achieved. At this stage, we cannot talk yet about concrete results. It's still early to measure. However, we trust the path we chose to focus on demographic resilience, not to security, is the right one. On long term, the individual aspiration, rights, and choices of people will be realized, and that is what ultimately matters. Thank you.
Thank you very much, Aliona. Yes, and it's well understood that in this shift that is needed, the first step is moving out of a numbers approach to changing policies. And you listed a significant and really impressive array of policies and actions that the government has now embraced, whether that was with regard to older people, work-life balance, employment, paternity leave, continuing looking for data to track all of that, family policies, family-friendly, gender equality policies. So a really, really impressive array of policy shifts. And I think you can know that a lot of eyes will be on Moldova to see how your experience continues in this positive trajectory where we're thinking more about people rather than population numbers. So thank you very much for those. Thomas, let me ask you, we're running close to the actual the end of the session. Thomas, So on the data question then, is there anything actually that you've heard from the conversations so far from the other panelists that you would like to respond to in terms of data that we have, or gaps in the data, or shifts in the way we measure things? Is there anything that you would like to say about that?
So
yes,
so
Thomas.
maybe thank you,
Yeah.
and maybe instead of talking about data and measurement, let me speculate a little bit about the post-pandemic future, and that can allow me also to reflect a little bit on what the other speakers have said.
Yeah.
Based on the experience we have so far with birth trends, we see that there is births are not only postponed, but when situation improves for some couples, some of the postponed births are being realized. So there is a pent-up demand among some couples, at least, to have kids when the situation eases out and when the situation improves. And this is, of course, where the importance of good policies, good family policies, which are not constraining human reproductive rights, is coming in. But I would say that even earlier, what's really important is that our lives are getting back to normal as much as possible. The scars the pandemic have left on many lives of young people, single mothers, and families are huge. So I would say maybe the best post-pandemic policy is to start with universal vaccination. Whatever the governments can do to motivate even young people to get vaccinated. Then it's opening the labor market, getting the labor market to function also for women. Many women lost jobs during the pandemic because of their family duties, because of the stress at home. If this is not improving in the future, we will not see any recovery in birth trends. And then the interesting thing is about the situation of young people, because in the 2010s, many countries didn't actually experience much of a fertility recovery after the financial crisis of 2008 to 12. And one of the agreements among many demographers, it is because young people, young adults didn't benefit from the economic recovery. They were increasingly seeing a lot of economic pressures, stagnating income, unstable jobs, inability to reach, to have a decent housing, to have enough money to buy a flat. And all these things combined, if we don't address them, we cannot see much of a recovery in birth rates in the future. And there are also, maybe just to cut the long story short, there are also some positive things which we observed during the pandemic. We see that many people can flexibly decide between working from home and from the office. That could help many families in the future if the companies and the governments really push for this system to remain. 40, 50 hours of sitting in the office is not really a recipe for combining kids and combining careers. And then also the governments stopped being so much allergic to spending money. We see big spending packages in the US. We see the ambition in the European Union of spending a lot of money on post-pandemic recovery. And there is a lot of discussion of how some of these resources can be spent to boost family policies, to provide universal childcare for very small kids, to support single moms, to support parents on parental leave. And this also relates to many of the issues Ms. Aliona was mentioning. So there is a lot of space of learning from all the mistakes and issues during the pandemic to build more child-friendly and family-friendly societies in the future. And that would boost birth rates to some extent, because we know that many couples want to have kids. So it's not about not having kids because of the climate change. It's about helping people who want to have kids to realize their reproductive plans.
Thank you, Thomas. Thank you very much for focusing on the needs in terms of recovery, rebirth of our societies, and the call for investment in the right sectors that will make a difference for now and the future. In that investment in human capital, which we know will be of benefit to individuals, societies, and countries going forward. So the old cliche of the word crisis in Chinese is made up of two symbols. It's made up of the the negative and the positive, opportunity as well as difficulty. Stuart, can I turn to you now for a final reflection, perhaps on what you've heard? Anything to add to the conversations that have been touching on issues that you've raised at the beginning, actually, about different parts of the policy-making machinery, thinking more positively about population and a positive vision for the future rather than just a focus on numbers. Any other things that you would like to add, Stuart, in terms of that conversation that we've been having, looking forward?
Yeah, I mean, I just to kind of round things off. I mean, of course, in theory, well, firstly, this is happening, so we have to adapt. And governments and partnerships. It's not just going to be governments that deal with this. It will be governments, NGOs, communities, families, partners, parents, mothers-in-law, companies, employers, sisters, brothers. Everybody is going to have to be, adapt to this new environment. In theory, of course, you could say that a smaller, healthier, older, better educated, richer population could be better. It could have a lower carbon footprint. It could be, it can ride the wave of AI into the future and everything will be fantastic. But we don't have a lot of evidence of this so far, because we are indeed at the crest of that wave, right? We are just moving into this new paradigm to which we need to adapt. And we've heard some, and Stephanie is exactly right. We're still stuck in this kind of neoclassical economics growth mindset. Whereas if we look for other metrics, whether it's in terms of happiness and well-being, we can have a brighter future. But we can't ignore the root causes and the root problems, because we've heard today that if you design policy based on a spreadsheet, right, based upon what you think a number should be, the right number should be, then even worse, if you wed that spreadsheet to an ideology, you get lousy policy. You get lousy policy that hurts people, that has a long-term consequence. Decree 770 by Ceausescu was that you ban abortions to maintain demographic growth. This is ridiculous, right? These are terrible things. And again, those are extremes. But even today, you would say, well, we can just increase the retirement age. But if you're in a country where those who are retired are a main primary source of childcare, then you can actually decrease the fertility rate by increasing the rates of the age of retirement without putting other parts in place. So I think really what we need to do, it's not that difficult. We had a document, I'm not just saying this because you're UNFPA, but we had a document in 1994 from Cairo, the International Convention on Population and Development, and it has most of the answers in there, right? We knew the answers, right? You put people first, you put rights first, you put equity first. You understand the reasons why people are leaving countries, why people are having fewer children than they want to do, but than they would like to have, and you address those reasons and you address that gap. And and that's not going to be done through a few $100. That's not going to be done through browbeating, haranguing, shouting at people. That's not going to be done through restricting access to reproductive health and sexual health services. That's going to be done through an all-of-government approach, across a community-based approach, and a paradigm shift. And that's really, so we have the answers there. We know what we have to do. Make much more of a concerted effort to actually get there.
Thank you very much, Stuart. Very clear vision, and thank you for reminding us, as we celebrate World Population Day, that the International Conference on Population Development in 1994 did set out a lot of these things. I think what we've heard today reminds us that firstly, this conversation around population, particularly when we think of population in terms of rights and choices, is as relevant today as it was in 1994 and will continue to be relevant in a very, very complicated and changing world, a world where we will have climate change, we will have digital change, we will have changes in many ways that we haven't anticipated. And the only way really to navigate through that is to make sure that we're thinking about people first. And we used to have a phrase in UNFPA, because everyone counts. And I love that phrase because it's not about counting people. It's about making sure that everybody is counted in a sense of not just numbers, but counted for the contribution that they can make to societies. And by harnessing that potential, by creating the conditions and the environment in which people can thrive, then so will our societies and nations thrive. A big, big thank you to our panelists today, to Thomas, Stuart, Aliona, Basha and Stephanie. A big thanks also to the colleagues who've helped behind the scenes to put this together. I think we've had a really, really good conversation. I hope it's been of interest to those who've listened. We'll continue to receive and exchange views on this through the chat and through UNFPA. But also I think we've got some exciting topics lined up based on today's conversation about what's next in terms of building demographic resilience, ensuring sexual reproductive health and rights for all. I'd like to thank everybody very much for joining us today. Take care, stay safe. Thank you again. Bye for now.
Bye-bye.
Goodbye.
Yeah, bye-bye.
Thanks.
Bye.